Medicine interested me in many different fields. I like surgery because of what I can do for the patients. I feel that we all have healing powers in different areas, and I feel my expertise in surgery as far as healing and pain, and in those areas I feel I'm best equipped at. I also like the operating room theater. I like the stability of it, and I like what we can offer patients in that. I'm very good with my hands, and I've always been very good with my hands, and felt that what I could offer in the field of medicine with what I could do with my hands was best fit with surgery. I think what's important is that the patients know that the surgeons understand that there's a very anxious and fearful event that's going to take place, whether it's the most minor of procedures or the most major of procedures. We treat each patient the same. And we understand that you are willing to give yourself up into our hands. And it's a very difficult thing for many people who have control of their lives, that they're going to be asleep and expect that when they wake up that everything that they knew was going to happen was going to happen. This is what we do as surgeons, and we control our room in the operating room so that the utmost respect is being done to not violate any of the private natures that the patients would be concerned about, and that we're doing exactly what they came for us to be done, and that they have consented to everything and understand that everything that we're doing is what they expect. So, you know, I think for most part our patients are very at ease, and we talk to them before they go back to the operating room as well, that they're very at ease at what is going to happen, and that outside of the fact that they have no control over what's going on, that we're there for them and we're advocating for them, and the staff that's there is advocating for them as well. I did my training in the area, and I've been to several hospitals, several university hospitals outside of the area. I've trained in a lot of different venues. I like the community type of a hospital. I like the community that we're in Saginaw. There's good people here. There's good physicians here. We offer basically the same kind of services that you would see in a larger institution. There are some specialties that we don't offer that we certainly will refer to those specialty areas, but as far as our skills go, I don't think there's anybody outside of the area that's any better at doing what we do. And I'm not saying we do it any better than them. I think we're as competent as anybody outside of the area. And it's obvious in the techniques and some of the surgeries that we offer that we may be actually ahead of the curve outside of areas outside of the Great Lakes Bay region. So I think that's one thing that people should consider as far as their choices that are made, as far as why would I stay in the Great Lakes Bay region? Well, I think the care you're getting and the advice you're getting and the treatments you're getting are as good as you can get anywhere in the world. And I think that's one big reason. What Covenant offers us is they offer us the ability to do the advanced technologies. They offer us the ability to offer the best medicine out there by giving us all the resources that we need to do what we do. We run a very busy trauma program for a very small community. We're a level 2 verified trauma hospital that admits close to 1,200, 1,400 patients a year. That's as busy as what we would call the busiest trauma centers in the nation. And we have very good outcomes, as would be shown by our data that our trauma program lays out. So, and it took a lot of resources and a lot of money for the hospital to invest into to allow us to do what we do there as well. So I think across the board, Covenant allows us to do the things that we feel passionate about and we feel we can do to help our patients the best.